hospital emergency room with a sexual assault nurse examiner on staff is trained to take steps to assess a sexual assault victim's injuries, relieve mental anguish and physical pain, and act to prevent pregnancy. And sexually transmitted infections. They also collect evidence for possible criminal prosecution. Sexual assault examination kits, or rape kits as they are commonly called, manufactured by the Searchy Company and provided to hospitals across Ohio, contain the needed tools and a checklist of steps to guide examiners through the process of forensic evidence collection following a sexual assault. Although the boxes look alike, every victim is different. The nurse examiner will use professional judgment to tailor the examination to the individual circumstances. Patients will also be offered an advocate to support them through the process. Also, while the typical victim depicted here is female, male victims of sexual assault undergo a similar process, slightly tailored to their different needs. But in broad terms, here are the steps the kit recommends. First, the patient is asked to give consent for the examination. This consent isn't a one-time yes or no, but rather a cooperative and ongoing process. The patient can consent to some parts of the examination and decline others. The consent may be withdrawn at any time. The narrative of the attack is then established. The victim tells her story. How she describes the attack, as well as how much of it she can remember, will help determine which steps in the evidence-gathering process may be the most important. Now the victim undresses. Examiner search for injuries and soreness on their body. Then the nurse swabs for possible evidence outside of the body, as well as conducting careful and internal examination of the vaginal and cervical areas. This is a difficult time for most patients, and the nurse and advocate stay engaged to try to keep things as light and calm as possible. The next steps involve collecting samples from the victim's body. Some or all of these samples may be collected depending on the type of assault, although some of them are always required. A victim advocate can stay with the victim if they wish, and again, consent for any part of the examination may be withdrawn at any time. For example, an examiner would collect urine, head hair, pubic hair if present, oral swabs, fingernail scrapings, swabbings and cuttings, swabs of the anal and perineal area, swabs of the vaginal area, or penis if the victim is a male, and if drugs such as date rape drugs are believed to have been involved in the assault, blood samples. The victim's clothing is collected, examined for stains that may be sampled, and carefully packaged so that no unseen hair or fiber evidence is lost. The victim's care continues with treatment for trauma and injuries, as well as testing and preventative care for pregnancy and sexually transmitted diseases. Meanwhile, the rape kit forms and samples are carefully sealed in their box, with the kit's chain of custody carefully monitored and noted as the contents make their way to potentially be submitted as evidence of a crime. That's if a victim makes the choice, and the choice ultimately does lie with the victim, to officially report